Hawaii's healthcare worker shortage is getting worse. According to a recent survey from the Healthcare Association of Hawaii, vacancy rates have almost doubled since 2019. The shortages are most felt on the neighbor islands, but a proposal in the state legislature could help. Nikki Schenfeld explains.
One Maui resident says he's had an ear infection for over 10 months.
I still have hearing issues and I cannot fully clear my right ear, and I'm still dealing with the same problem.
He's gone to clinics and had an ENT specialist give him the same treatment of antibiotics and nasal steroids. Last month, the ENT said it would take another month to see another specialist. Frustrated with the same unsuccessful treatment, he's been trying to get to Honolulu, but can't get on an airplane due to his ear.
It's been, I think, about probably 10 months by now, 9 or 10 months, that I haven't been able to fly or go paliakala or do any activity below water.
It's just one of many stories where neighbor island residents have struggled to get care.
Places like Maui, it's a great place to live, but it's an expensive place to live. And because there's a shortage not only in Hawaii, across the nation, healthcare professionals have choices of where they want to go.
And reports show paradise isn't enough as more workers continue to leave. A recent healthcare report showed there was a 10% vacancy rate in 2019. Last year, it jumped to 17% statewide. The state is roughly 750 workers short, and more private practices continue to close their doors.
The cost of living is a real issue, as is the relatively low reimbursement for many healthcare providers in the state. And the recent story about the OB clinic or operation that is shutting down later this year is very, very troubling and very challenging.
A JABSOM survey found physicians who left Hawaii said it was the extra cost of caring for Medicare, Medicaid, and Quest patients, which made it financially burdensome to practice. A bill moving through the legislature would provide Medicaid payments at 100% the Medicare rate. One Kauai physician testified in favor of the bill, saying his facility will likely close its doors because the Medicare and Medicaid insurance payments are below the cost of providing care. And Hawaii has one of the lowest reimbursement rates in the country.
The specific ask is for $30 million in general funds on a recurring basis that will draw down an additional $43 million of federal funds on a recurring basis for a total of over $70 million a year. And this legislation is designed to close the gap between Medicaid reimbursement and Medicare reimbursement.
Nikki Schenfeld, KHON2 News, working for Hawaii.
Nikki, thank you.